Hi, my name is Shirley Morgan, and this is my collaboration and leadership video reflection for NUR FPX 4010. In this video reflection, I will explain strategies for managing human and financial resources to promote organizational health, how interdisciplinary collaboration can be used to achieve desired patient and system outcomes, and how change management theories and leadership strategies can enable multidisciplinary teams to achieve specific organizational goals. For this reflection, I will discuss the personal interprofessional collaboration I experienced as an inpatient nurse. I was working as a night shift nurse, and I had taken over care of a patient who was post-operative of a toe amputation. The organization for which I worked for utilized electronic medication systems and noticed that this patient had a blood thinner due later that night. Often, if physicians want medication held for a certain date or time, they will put a stop date and a restart date on the medication in the electronic system. I questioned this order since the patient was not even 1 day post-operative of this amputation and decided to reach out to the on-call provider that night. I discussed with the provider that the patient had the amputation earlier that morning and that this blood thinner was scheduled for 10 p.m. We discussed the patient's history, and the on-call nurse practitioner had decided since the orthopedic surgeon had not put the medication on hold, it would be fine to give since the patient had no active bleeding. I gave the medication at the scheduled time and was continuously checking the patient for any signs of bleeding. Later during the shift, I was able to read the provider notes entered for that day, and the orthopedic surgeon had written in their note that the blood thinner should be held tonight and restarted the next day. I had the on-call practitioner come up and assist the patient and decided to call the orthopedic surgeon to update him of what had happened. The patient was fine, and as expected, the orthopedic surgeon was upset that the patient had received the medication. I explained that the medication was not held in an electronic system, and I had only known this medication should have been held by reading the notes for the day. The orthopedic surgeon came in that morning to see the patient, and thankfully there were no complications. Interdisciplinary collaboration is used every day in nursing. We collaborate with other nurses, physicians, and advanced practitioners about the patients we care for. As nurses, we are in the center of interdisciplinary collaboration. We spend the most amount of time with our patients, so we advocate for them within the interdisciplinary team. With our collaboration, the other team members can deliver patient-centered goals. Poor interdisciplinary collaboration was demonstrated when the scheduled blood thinner was not placed on hold by the orthopedic surgeon and I gave the medication. This is considered a medication error and did result in the patient having a longer stay in the hospital, which cost the organization more by having to utilize more resources for the patient. Successful collaboration happened when the on-call practitioner was notified of my concern about the medication and when the provider came to assess the patient and when I informed the orthopedic surgeon that the medication had been given. This situation could have been avoided had the orthopedic surgeon placed the medication on hold in the electronic system and I had read the notes of the surgeon before giving the medication due to my concern. An estimated $6 billion in preventable costs for organizations were due to communication barriers. Establishing effective communication between healthcare professionals will help create shorter hospital stays and fewer adverse events. University of Phoenix, 2024. ANA Nursing Resources Hub states that transformational leadership in nursing allows for management style of open collaboration. The goal of this leadership style is to deliver exceptional patient care and outcomes. The Plan to Do Study Act allows us as healthcare professionals to identify the problem, implement a plan, and see what the outcome is. I see this change theory used often in interdisciplinary teams and offers the team to see where improvements can happen. Transformational leaders encourage teamwork and collaboration between all healthcare professionals involved in patient care. If transformational leadership had been utilized during my personal experience, I might have felt more comfortable communicating with the orthopedic surgeon first instead of the on-call provider. To have effective interdisciplinary collaboration, some best practice skills are to improve our cognitive and social skills, like teamwork, communication, and decision-making. Buljak, Sandrick, et al., 2020. Using tools such as the SBAR method, situation, background, assessment, and recommendation, allows us as healthcare professionals to deliver concise communication of the patient we are discussing. Utilizing interdisciplinary collaboration allows multiple healthcare professionals with diverse experience to care for the patient. This enhances patient involvement in their care and ultimately increases patient outcomes. Interdisciplinary collaboration encourages open communication between multiple healthcare professionals, such as nurses, practitioners, physicians, and pharmacists. As a new nurse in my experience, I was scared to communicate my concerns to the physician. Now, as I have grown in my experience, I am more comfortable communicating with other members and patients' interdisciplinary teams. I continue to educate myself on ways I can become an effective team member within the interdisciplinary teams I am a part of. We aim to ensure our patients receive coordinated care and effective care, and that this is possible with successful interdisciplinary collaboration, and this can happen with the transformational leadership and the change theory I discussed. Thank you.